Hello, my name's Dr. Frances Radkey, and I'm an internal medicine physician. I actually began my career as a registered nurse and worked in multiple large universities and their intensive care units for over 10 years. I was accepted into medical school at the University of Nebraska at Omaha and graduated there, decided to attend their primary care residency, also in Omaha, Nebraska. I think the biggest life-changing decision I made was to become a doctor. I knew how to take care of patients as a nurse, but when I became a doctor, I became part of that team directing their care, becoming responsible for their outcomes, and making the best care plan possible I could for each patient. As a nurse, I still am able to give care to my patient like I did before I became a doctor, and that's still a big part of me. I see a large variety of patients. My youngest patients are 18 years old, just entering adulthood, and having their own unique set of healthcare problems. My oldest patients are over 90, and in fact, I have a few patients over 100 years of age. I think because I did primary care, I see a wider range of patients than most internal medicine doctors do. My primary care background allows me to focus on primary care and preventative health care. My internal medicine background allows me to focus on adult medicine care. And by adult medicine, I mean that I can take care of complex patients on multiple medicines and those people with chronic disease processes. And I see chronic disease like congestive heart failure, diabetes, thyroid disease, geriatric issues, and women's health care issues, and hundreds of other diagnoses that encompass internal medicine. The primary care side of me helps me take care of routine healthcare problems. If you have a cough, if you have a cold, infections, I'm more than glad to see you. If you just don't feel good, come in and we'll take care of you. I think it's important that internal medicine doctors are board certified. I have passed the internal medicine board certification myself, and that means that I'm keeping up to date on my medical information, and I'm doing my best to try to keep up with all the new drugs coming on the market. In addition to that, as a physician, I have to maintain a certain number of continuing education hours every year, and that's just a different way to keep up to date in the medical world. As far as my healthcare philosophy, I think it's important that we work as a team. The patient needs to be part of that healthcare decision-making process. Every healthcare problem has multiple options. Let's take a look at option A, at option B. Let's discuss it and pick the best option for you. You know, medicine always has new things coming out, and maybe one of these new treatments or medicines is going to be the thing that works best for you. I think it's important to be accessible to my patients, and if you have a question outside of your office visit time, I do encourage you to call my office. If it's a simple question, we're going to return your phone call and answer that question. If it's a complex question, we're going to talk and decide if maybe you should come in. We talk about it face to face, do a physical exam, and then make a better decision about your care. Sometimes your workup may require us to do x-rays, lab, or other tests. And if that's the case, we're going to schedule those tests and have you come back because I'd like to go over the tests with you, discuss their results, and then fix the plan in place for you. Every single office visit brings new information to the table. I really do like it when patients bring a list of their questions to the office visit. We can look at it, pick the most important issues to take care of first, and if by some circumstance we can't get to every question you have, we're going to set aside time for you to come back and we will get every question answered. I think it's important to bring a list because then we will take care of everything at one time. One of the reasons I really do like internal medicine is I get to have a long-term relationship with my patients. I have a chance to get to know you, your family, what brought you to the area. Were you born and raised in the area? Every little bit I get to know about you helps me tailor your health care plan to fit better into your lifestyle. So I do look forward to seeing you. Thank you.